Hi, everyone. Thank you for joining us. We'll give everyone 1 minute to sign on. Okay, we are at 12:16. I guess we can get started. I'm gonna pass it over to Wagata to kick us off.
Hi, everyone. Thank you so much for joining us for today's webinar. My name is Ogata Semre. I'm a physician, associate professor of medicine at UCSF, and I direct the Champion Provider Fellowship. I'd like to start off with our UCSF land acknowledgement statement. We would like to acknowledge the Ramaytush Ohlone people, who are the traditional custodians of this land. We pay our respects to the Ramaytush Ohlone elders, past, present, and future, who call this place the land that UCSF sits upon, their home. We are proud to continue their tradition of coming together and growing as a community. We thank the Ramaytush Ohlone community for their stewardship and support, and we look forward to strengthening our ties as we continue our relationship of mutual respect and understanding.
Okay, thanks, Wagata. I'll take over for housekeeping. We will keep everyone muted throughout the course of this presentation. If you have any questions or general comment during the presentation, please use the chat box. I will be monitoring the chat. The webinar is being recorded and it will be posted on our website by next week. For best viewing, we recommend using your computer audio and maximizing the Zoom window. If you're having any technical issues at any point, please message me in the text box, in the chat box. Then next, we have our upcoming events. We have our works in progress call for our fellows on Thursday, August 8th from 12:15 to 1:15. And then we also have, in lieu of the quarterly LHD call, we have the Champion Provider Fellowship Recruitment Q&A webinar for LHDs. We are starting our 2025 cohort recruitment this fall. Please sign up for the webinar on Thursday, August 15th from 2 to 3 p.m. You can find the links to register on our website at the link at the bottom. I will hand it back over to Wagata.
Great. I'm very pleased to introduce today's presenter, Dr. Trinidad Solis, who is an alumna of the Champion Provider Fellowship and the current Deputy Health Officer for the Fresno County Department of Public Health. As health officer, she is responsible for guiding Fresno County's health response to disease outbreak and assisting with health programs that promote chronic disease prevention. She also coordinates the department's Rural Mobile Health Program, which aims to make healthcare access more equitable for farm workers and for people living in Fresno County's rural areas. We look forward to hearing more about that program today. And without further ado, I'll hand it over to Dr. Solis. And just a reminder that we will allow time at the end of the presentation for questions.
Great, thank you. Okay, so I'm going to share my slides here. All right, can everyone see them? Or Nancy, can you see it?
Yeah, I see it, but it's the entire PowerPoint. I don't even want to click on the slideshow and then click on start from beginning.
Okay, let's see. So here you mean, Nancy, or?
On the
presenter view. That's right. Yep.
Yeah.
If you click that, it should switch to presenter view.
Is it still doing that? Oh, let's see.
Oh, try that one more.
Let me try one more time. Yeah, because usually, okay. Sure.
Can you try that icon way at the top? That's a picture of the kind of slide with a little play symbol in the middle, like the play.
Yeah, in the orange
Orange bar.
part, but yeah.
Exactly. Should be something kind of on the left side.
Yeah.
Where it says, okay, display settings.
Where would you be looking? Let's see. It'll
This-
be very close to the title, presentation title. Yeah, you're
Okay. Now go to display setting and swap, because then you might have two screens.
Mhm.
Yeah, that's what's happening.
Yeah.
Okay, good.
Yes, got it.
Is that better for everyone or?
Yes.
Yeah.
Okay. Yeah, sorry, this usually doesn't happen. I don't know what's going on, but okay, we'll get started. So, hello everyone. Thank you for that introduction. As was mentioned, so my name is Dr. Solis, and I'm the Deputy Health Officer at the Fresno County Department of Public Health. And before I talk about the Rural Mobile Health Program, I did want to share a little bit more about my background and how I came into public health. So I was born and raised here in the Central Valley. And then I left for college and medical school. And then I did do a master's in public health at Johns Hopkins. And I decided to also do family medicine residency and training. So I went to UCLA for my family medicine training. And after I finished my residency training, I stayed at UCLA for a few years and was doing 100% full clinical practice. But I found myself wanting to do some public health. I had gotten this MPH and and felt like I wanted to use it a bit more in my day-to-day tasks. And then the COVID pandemic started, and that's when I decided to transition. So I ended I transitioned from my position at UCLA, and I moved back to the Central Valley and started working as a part-time public health physician for the Fresno County Department of Public Health. And then I was also faculty at UCSF Fresno Family Medicine Residency Program. So that's how I started in this position. And then 2 years ago, I got appointed to be the Deputy Health Officer. So usually for health officers, you have to be appointed by the local Board of Supervisors, which usually includes 5 elected officials in each county. So I did have to interview and get appointed. So it is that's the process. I did want to share that in the past, I've done like a health policy fellowship in Sacramento. So I've also been interested in policy, and I worked for an assembly member. And this was before medical school, but just sharing that, I did different experiences than most of my medical colleagues, and showing that there's different paths to get there. And so right now I am board certified in family medicine and also do public health work as discussed. And for the my role as deputy health officer, as mentioned, I help with like disease outbreaks. So during COVID was involved with that, monkeypox, also help out. We have clinics in our department. So I help out with our with our TB clinic. So usually our TB clinic deals with active cases, and other physicians, hospitals call in and ask for guidance, and we help manage that. And we do have an infectious disease doctor on that leads that clinic, but occasionally, he needs assistance and we help out. And then we also have an STD clinic. So really we're the safety net for people who don't have health insurance and need to be seen. Okay, and I wanted, for those who may not be familiar with Fresno County, it is a population of over 1 million people, and it is the largest county in Central California. Predominantly, it is majority Latino population. About 55.7% of the community is Latino, and 16.2% of families in Fresno County live below the poverty line versus 8.9% of families in California. And population by age, about 26.5% are below 17, and 59% are between 18 and 64. So overall, fairly young population compared to other counties in the state. And I wanted to provide a few more like just background statistics on the county. And this is taken from our community health assessment. And our community health assessment provides quality and quantitative data that's, from surveys with our community-based organizations and also hospitals. And every few years we put out some of this data, and that helps us identify like the needs in the community. What are the CBOs saying? Like what does the community want and need? And that really helps shape our priorities. And so for this slide, this is again, this is like the most recent report from 2023, and it shows you really the shortage of health providers across the spectrum here in the Central Valley. So when looking at doctors, for every for every 1,490 people, there's like one doctor for that. So the ratio, as you can see, for the California state average as a whole is 1,250 people per one provider. So there is a big difference there. And then when looking at dentists, similar, about 1,610 people per one dentist. And then for California, 1,150 per one. And then it's a bigger disparity with optometrists. So per one optometrist, per 7,445 people in Fresno County, versus in California, one optometrist per 1,016 people. And a few more statistics. So this is looking at the cost and lack of insurance or other insurance issues on people here in the county. And 11% of adults and 8% of children delayed or did not get prescription meds in the past year. 18% of community-wide survey respondents have trouble paying for medication. 8% of residents said that they had to forego needed medical care in the past year. 12% delayed or did not get medical care in the past year. And Fresno County teens are more than 2.5 times as likely as California teens to have teeth and fair poor condition. And lastly, 32% of Fresno County adults describe the condition of their teeth as fair or poor versus 25% for California. And I do want to highlight, so this was from 2023, but this year, Medi-Cal did expand their coverage, so that now it covers undocumented and really from all ages. So I'm hoping that, because I know here, and not only at the health department, but our Department of Social Services and also our federally qualified health centers, like they're really trying to enroll more people who are eligible into Medi-Cal. Because as you can see, a lot of these issues are because people don't have insurance or concern for medical debt. So we hope that with the medical expansion that happened in California, that can lead to some of the improvements in these statistics. And some overall barriers that we've identified here at the health department that are barriers to accessing healthcare in Fresno County's rural areas. So it includes lack of health insurance, as I mentioned, inability to pay medical bills, physician shortage, so that creates delays in getting a clinic appointment. We often hear from the community that to see a primary care doctor can take about 3 to 4 months to get in, and even longer to see a specialist. Language barriers is a common thing we hear from our community-based organization that is an issue for people when navigating the healthcare system. Lack of public transportation. So we do have like buses in the metro areas, but in the rural areas, there really isn't much public transportation. So if you have an appointment to see a doctor or, a specialist in the metro area, you're looking at about an hour, long distance. And if you don't have a car, it can be very difficult. Continuity of care issues. So we do have a large farm worker population in the Fresno County. And so, sometimes with farm workers, it could be like migrating farm workers, meaning they come with the crops and the season, and then they'll move elsewhere. So sometimes that can be difficult for the farm worker themselves to get continuity of care. But also the physician shortage also makes that difficult, like I said, because it can take some time to get an appointment. And then, we hear about fear of using healthcare due to immigration status. So sometimes there's concern about, it's a public charge, or like, will it be used against someone if they don't have immigration status and they're using the healthcare system? And, that is a myth. Like even with enrolling in Medi-Cal, that is a myth that we hear, and we try to assure the public that no, that does not count as public charge. But again, that is a barrier that we hear for people for enrolling in Medi-Cal and insurance. And and so it is a need a myth that we're constantly trying to clarify to the public. And so this brings me to the Rural Mobile Health Program. So when I started at the health department, I really was involved with helping our farm worker population get access to COVID testing and COVID vaccines. And for the first time, really, we developed great relationships with our ag employers. They were opening their doors to us so we can vaccinate their employees. And really, the idea of like meeting the community where they're at was really important. And we had a lot of success. We gave over like 35,000 COVID vaccines to farm workers in the area, and we got national attention because we were one of the first to do that. And so building off that success, we decided to allocate some of our county's American Rescue Plan Acts to build a rural mobile health program where now, in addition to COVID vaccines, we also could offer other services, which I'll touch on in the next slides. But every county received ARPA funds, which are federal funds that were distributed to help with the public health and economic recovery efforts related to the pandemic. And so for us, our Board of Supervisors approved $6 million for a 2-year Fresno County Rural Mobile Health Program. So it started in January 2023 through January 2025, but we likely will get another year extension. But yeah, so it was a process doing the proposal, going to the board, and then it was approved. And so the Rural Mobile Health Program is one of the first initiatives in California that aims to address rural communities and farm workers' medical and social needs in one visit. So in general, these medical services are at no cost to the farm workers and the people living in the rural areas. And really the unique thing about our program is that community health worker network where community health workers attend the rural mobile health events. And I'll on another slide, I'll describe a little bit more what they do. But really, that is unique because we see other counties have mobile health programs, other health departments, but that community health worker component is not often associated with that. And so we have shared like our blueprint about our community health worker network, how we standardize their training and so forth with other nearby counties so they can also implement similar programs. And so the goals of the Rural Mobile Health Program include increasing access to healthcare services among agricultural workers and people living in the rural areas. We also, as I mentioned, integrate community health workers at these events, and they provide health education and community linkages based on individual needs. And we also want to reduce local emergency room use by increasing access to primary care services. So as many of you are aware, about a year or so ago, one of our nearby counties, Madera, their only adult hospital closed down. And so because of that, really the adults in the area had no other, if they had an emergency or so forth, they were majority of the time being transported to Fresno area hospitals. And we had to declare a local emergency because we were heavily impacted and it was also very busy with COVID. But you know, that's now improving with Madera. There are talks that they're going to reopen, but really I'm sharing this because by doing this intervention of meeting the community where they're at and even doing things such as refilling someone's medications for a month until they can get an appointment to see their doctor, that will prevent them from going to the emergency room. And oftentimes people, you know, a lot of the providers when we're out there, we see, and you know, I hear from the other doctors that people have high blood pressure, had no idea, diabetes, you know, first time being diagnosed with diabetes out there. A lot of farm workers tell us that they haven't seen the doctors in years. Sometimes it's their first time. So this is why it's so important for us to, this is one of our goals, because we want to help reduce that, help reduce that the hospitals not be so overwhelmed during this period. And so our partners, so we contracted to local medical partners to help deliver these services. So ourselves, like our own public health department staff don't do it, but I do, I help develop and help coordinate this project, but we do rely on the efforts of our medical partners to also go out there and actually deliver these services. So we've contracted UCSF Fresno and St. Agnes, and we're very intentional. Both of these hospitals are teaching, you know, they teach residents, they teach medical students. So UCSF Fresno has emergency and family medicine residents out there. They're also opening it up to other primary care specialties, and same with St. Agnes. We also invite other nursing programs, pre-med. So really, we want to teach not only residents, but also the future healthcare workforce of how to treat patients in rural areas and how to care for underserved communities. And some of the services they provide include immunizations, as I mentioned. So we started with COVID and flu, but now we're also offering routine vaccinations. As we've seen in the news, there's a lot of talk about measles and rising cases. So we do offer the MMR. So all the required K through 12 vaccines, we do offer blood pressure checks, glucose testing. And a lot of this has evolved. At first, it was like these basic screens of blood pressure, glucose, doing a COVID test to treat. But now we've also started to expand to do STD screening, where like point of care tests, chlamydia, gonorrhea, syphilis. We were one of the first in the state to start offering point of care syphilis out in the field. And unfortunately, we do have high rates of syphilis in our community and unfortunately congenital syphilis. And so this is something we're doing, not only testing, but for those rapid tests, if they're positive, they also offer prescription medication right there. And then access to contraceptive care. So this is also something very unique. We're partnering with a nonprofit. It's called Upstream USA, and they've been very successful in the East Coast, not only training providers, but also offering free contraceptives like not only birth control pills, depots, but IUDs to the communities. And Governor Newsom asked Fresno to be a pilot site for Upstream. And so our UCSF Fresno, like our rural mobile health partner, is part of this pilot program. And this is the first time Upstream is working with a medical partner to do contraceptive care in a mobile unit. So we're starting off with birth control pill and depot shot, and we'll go from there. But again, this is really big, especially because Fresno is designated a contraceptive desert, meaning it's really difficult to access contraceptive care, and we have high rates of teenage pregnancy. So this is a new development with our program. Okay, and in addition, we also have vision. So as I shared earlier, we have a high need for optometrists in the area. And so we've contracted a mobile vision partner, and so they're known as Suchi. And again, this is no cost to the people who attend their clinics. And it includes eye screening and complete eye exams for anyone 5 years and older. For those who are found that they need glasses, they can get single vision glasses that are provided, and they're made on site within the hour. And we do have an appointment system so people can sign in, but they also allow walk-ins. And so right now this is happening about once a month, but we are trying to increase that and working with Suchi to try to get more optometrists to help out and expand this service to the community, and really targeting those areas where there's not many like optometrists. Wanted to highlight about the great work that our community health workers do. So they provide health education in a culturally and linguistically sensitive manner on various topics, such as nutrition and diabetes and heart disease. And they also link individuals without a medical home to a nearby primary care doctor and share information on local public health programs. So this is another way we're trying to keep people out of the emergency room. The community health workers do have a social determinants of health screen that they perform. And if someone says they don't have a primary care doctor, they'll connect them to a nearby federally qualified health center. If they say they don't have health insurance, we've now partnered with our Department of Social Services, where at least for now, they've trained at least one of our community-based organizations to enroll people in Medi-Cal. So I really feel like this is a big, super important part of our program, because yes, they get medical services like one time there while they're seen, but this connection to resources, I think, is what will make a lasting impact as well on the patients that show up to these events. And to the left there or on this slide is just to remind everyone when I talk about social determinants of health, like what areas this covers. And this is taken from the Healthy People 2030 report, which you can look up if you want to read more. And I provided the link there. But yeah, so all of these areas is what the community health workers ask about in their survey. So after a patient sees a medical providers, they are then encouraged to talk with the community health workers and get connected to resources. And today, so we do track how, we track not only like the services that the medical providers do, But we also track how much the community health workers do. For example, like 72 clients have been enrolled in a care coordination program during these events, and over 1,770 health education materials were provided to residents so far. And I'm going to pause here because I always think it's, I've shared about what we do, but we have a little video that we created after our first event, which really just shows in general how it works, like on the ground, how a typical health event occurs. So let me just pause here and stop sharing. Okay, sorry. So now I'm gonna switch and share the video. Okay, so let's see if it works here. Can you hear that? Or Nancy, or you can hear that?
Yes, we can hear it.
Es una oportunidad buena para todos los trabajadores porque en realidad no tenemos mucho tiempo nosotros de ir a las clínicas, so es una gran oportunidad.
On January 3rd, 2023, the Fresno County Board of Supervisors allocated $8 million of American Rescue Plan Act funds to establish the Rural Mobile Health Program.
The Rural Mobile Health Program aims to provide medical services at no cost to residents living in Fresno County rural areas. This is a continuation of our effort to improve health for our farm workers.
Our workers feel like they're the last in line, the last ones to receive health care and many other programs that are available that we take for granted. This puts them first, something that they're just not used to seeing.
Before COVID and before ARPA, before all these federal funds, I was doing these services 2 to 3 times a month. And now with this mobile project, we're doing this up to 20 times a month. I would be lucky to get through 20-some patients in a visit, and now we're gonna see close to 200 today. Without funding, this couldn't happen. I absolutely love it.
Muy contento, agradecidos por esta oportunidad de venir y ayudarnos a todos los trabajadores. So, muchas gracias por esa oportunidad.
Okay, great. So I'm going to stop sharing. But again, I wanted to share, again, that's like an event at an ag. Oops, let's see. Sorry. See here. Yeah, that was an event at an ag facility. But yeah, I think at that event, they saw over 200 farm workers. So it was, I consider a very successful event. So I'm going to reshare my slides here. And okay, you'll have to let me know if it looks okay again, or Nancy, or looks fine.
Yeah, you have to click the little icon again to let it go to, yes, there it goes.
Okay, great. Okay. So yeah, I want to end the presentation with sharing strategies to how to improve some of the barriers we've identified and how the Rural Mobile Health Program is helping also improve access to healthcare, and then next steps for us. So in general, what we found is to improve healthcare access is referring uninsured patients to federally qualified health centers. So as I mentioned, when we identify, or our community health workers identify that an individual doesn't have a primary care doctor, then they have a list of local federally qualified health centers near where that patient lives. And so I didn't clarify earlier, but these events, they rotate at different rural sites in the community, but we also have a few reoccurring events. So the community knows, okay, they're going to be there that first Monday or like of the month. But yes, the the community health workers do have a list of that. And sometimes, as I mentioned, like the nearby hospital Madera closed, so we were sometimes seeing patients from Madera. So the community health workers would also have some resources available for nearby counties. Another strategy that we found successful is distributing these culturally and linguistically appropriate health education materials. We started off with basic materials about chronic diseases, like common diabetes, high blood pressure, obesity. But now we're expanding it to other topics, like I discussed, about STDs, and we're preparing about contraceptive care and explaining that to the community. So we have like a great team of staff here at the health department that evaluates this and makes sure that it's appropriate reading level for the community. So here in Fresno County, we do try to target a lot of our education for the 4th through 6th grade reading level. And when you look at materials, for example, from the CDC or NIH, it is much higher level, reading level. So that is something we do keep in mind. And we do always try to do flyers in at least English and Spanish, but it really depends on the area. Another high language that is often requested is also Punjabi or Hmong. So that's important in translation services. A lot of our rural mobile health staff people are bilingual, the medical providers, but our community-based organizations, again, the CBOs that we contract speak multiple languages, which has been very helpful in communicating with the community. And then for transportation services, here at the rural mobile health program, we meet the community where they're at. But for these strategies, I'm also talking about overall. So not only looking at mobile health programs, but how in general in a community can you help with transportation in a rural area. And so I often meet, with our local health insurance plans, and they promote this program about that they have for their members, which is again different medical plans, but they do have transportation services. So I want to bring this up because I know in this group there's a lot of there's not only providers, medical providers, but there's also dentists. But if you hear of patients and you're in a rural area that mention issues with transportation, there's now a lot of health plans that are offering free transportation to medical appointments. So that is something I often try to share. And just going a little bullet points earlier, because again, I do think it's important as doctors how we can help with this. So our CHWs here do share these health education materials, but I also think for our medical providers or even dentists, having such different flyers about the importance of being healthier, eating healthy, or how to manage diabetes, blood pressure, having that in your waiting room in different languages is also super helpful. But yeah, I just wanted to highlight that. And then mobile medical units with portable electronic medical records. So that is helpful, we've noticed with our medical providers, that does allow them, not only are they using their own electronic medical records, but if that patient shows up in the emergency room, it's all connected. And so that's how we're able to track also not only the patient's health and making sure that they're doing well, but also the effectiveness of our intervention of the mobile health program. Is it preventing emergency room visits, which as what we wanted. Another strategy is partnering with schools to increase healthcare access. So we know that, so for us, for example, for the rural mobile health, we do let the local schools know if we're having an event, especially because we know, the parents, when they go pick up the students, they can go and also attend the events themselves. But that's just another way, I think, to improve access to healthcare is partnering with schools. I know in Fresno County, our Fresno County Superintendent of Schools also has their own mobile program, and they do have events at the schools for the students, and occasionally they allow the parents. But I think for us with rural mobile health, we wanted to be a little bit more family oriented, so also the parents and so forth. But usually that's after hours for safety and so forth. But again, these are some strategies that our team has found successful for increasing healthcare access in rural communities. But again, this is not just specific for mobile health. As I mentioned, the transportation, translation services, the health education, that can be done in different settings. And for all of you who are in this call and, you're not in Fresno, but in other rural areas, just something for you all to keep in mind. And then for challenges and opportunities. So as I mentioned, for us, the ARPA funds, it was a one-time funding from the federal government to help with the COVID pandemic response. And likely for us, the funding will end the end of 2025. So I think for us, we're looking ahead, how are we going to make this program sustainable? We have, our preliminary data is showing that it is very impactful in increasing access to healthcare here in our rural areas, which have greater disparities compared to other regions, as I shared. And so just highlighting that for us that, we've started talks with health plans, for example, and philanthropy, and really just to discuss ideas of how perhaps we can braid funding together, because we're all working towards the same goal of increasing access to healthcare. So that is something I think, that we're often considering. We also talk with our medical partners about in the future potentially billing Medi-Cal for their services, because we see that other mobile health programs are doing that to address the sustainability piece. So yeah, so with any program, I think it's always important to address and think about that sustainability. So that is something that we're thinking well in advance now. Data collection and research. So we are, most health departments have access to what we call RevCap, which is a way to collect data. And so really it's whenever a patient comes in, we get, we document what service was administered so we can track what was provided. But as I mentioned, we are working with residents, and some, have submitted IRB proposals and are consenting patients and so forth. So there is some research going on. So not only are we improving access to healthcare, but I do think also showing best practices, what's working, so we can continue to improve health in the rural areas, not only in Fresno County, but sharing it, for example, with you all and with other partners. And then engaging with the media. So for us, we are always looking at ways so we can improve turnout. And I think for us, the next phase is engaging more with our media, trying to have more reoccurring events so the community knows that we're going to be at a certain site on a certain day. We, we have a great public health communications team, and we utilize social media and so forth to get the word out. But I also think engaging with other multi-ethnic media would be helpful as well to increase our numbers. And then, so Northern and Southern California have mobile health consortiums, but we don't here in Central California. So that is something we've been talking, because as I mentioned, it's not only Fresno County that has mobile health programs, but there's also other nearby counties. And I think it would be a good idea to meet and have some sort of consortium and share best practices. As I mentioned, our team that leads our community health workers, they have shared a lot of their best practices at statewide conferences or with other health departments. So I do think not only sharing about that, but also our medical providers, as I mentioned, like we're the first ones working with upstream to increase access to contraceptive care. So even things like that, I think would be beneficial, not only for our providers so they can learn from each other, but also in general for the community, so they can share those best practices. So again, these are a few of the challenges and opportunities I've identified for our program, but I think it's exciting. We have come a long way since we started in February 2023, and so I'm excited that we're continuing to strengthen the program. And yeah, I feel like it's really, we made a lot of progress. So I'm going to end there. I'm going to stop sharing my screen here. Let's see.
Thank you. Thank you so much for that wonderful presentation. I think it's really helpful to see the overview of how the program developed, and also just the broad challenges and opportunities that you've been seeing in Fresno, and thinking about how some of those principles can apply more broadly to other areas. So we have some time for questions. And as we dive into that portion of the presentation, please feel free to put some questions in the chat. And also we'll be able to unmute you if you'd like to elaborate on any questions. And I'll just highlight that there were a few questions that came in, a lot of interest around understanding the community health workers and that innovative piece of this program. Questions about whether they're paid. They are, I understand, and they're subcontractors of the county, which was another question that came up. Christine, thank you for answering those in the chat. But yeah, if anyone has any follow-up questions about that, please feel free to unmute yourself and ask those. But as we're waiting for some of those questions to come in, maybe we'll start there. And I'm wondering if you can elaborate a little bit on the piece of that sort of workforce development and how you guys are maintaining that, their training that's happening, what has made that successful, and how do you see that moving forward as you think about the sustainability of the program?
And just to clarify, you're talking about the medical providers, like their teams?
The community health workers as part of the team and that network, and broadly the medical providers too. Sure.
Yeah. Well, since I see Christine here, I may also pick on her. So she's also one of the liaison with our community health workers at the Fresno County Health Department. So thank you, Christine, for joining. But I can at least start with the medical provider, and then Christine, if you're welcome to talk about the community health worker piece. But with our medical providers, they do, they do have a few faculty that run the medical provider team, but they also open it up to residents. And so they have like community health rotations. So that's how the residents are able to rotate. And they open it to family medicine residents, internal med, emergency. And they also have medical students that also rotate during their community health rotations. We partnered with nearby nursing programs. So now some nurses also come by. So really it's like during their community rotations, but they have like a set faculty that someone's always there. And we also have interest, like even from a younger pipeline, like we've had high school programs reach out and they're like, hey, there's programs where they're trying to train high school students how to be MAs at such a young age, which I think is great. And, we get approached, can we have some of our high school students joining your events? So I think, we're seeing like a growing need for more students to get these type of experiences. And I feel like I myself, I grew up here and came back, and I feel like one of the reasons is because I had that connection with the community. So we're trying to also hopefully create that experience for the residents, because many of them who train here, a lot of studies show where you do your residency, you tend to stay. And so I think that's one of our goals. I didn't mention that in the PowerPoint, but we like creating these type of experiences hopefully connects more doctors to the community. But other workforce that I didn't mention, like we've been approached by a nearby physical therapy program saying like, hey, can we join you if you're at any senior living center? We'd like to do some walking assessments. So I think like these type of mobile health programs have a lot of potential, and there's a lot of interest, especially from academic institutions that are training like the next generation. But yeah, so that's how for the at least medical providers point. And Christine, if you want to highlight anything for the community health workers.
Yeah, hello everyone. Good afternoon. My name is Christine Vang. I'm the health educator with Fresno County Department of Public Health. With our CHW network, we have 3 different hubs, as we like to call them from there. And so with our CHW, we have a network about 60 of CHWs from there. And so with that from there, we do lunch and learns from there, or we have the CHW monthly meetings that we meet once a month. And we also, separately of that, we also have the CHW stakeholder meeting as well. And this is with all community members in the Fresno County who is interested in community health worker network from there. And I do want to touch base with our specific program with health disparities when we collaborate with Rural Mobile Health with Dr. Solis and her team. One incident was the avian flu. So we had a lunch and learn, and our CHWs were able to learn about avian flu, how to have the same messaging around that. We had it in English and Spanish because we do serve most of our clients do serve Hispanic, Spanish-speaking population from there. And so it was just a great way to really make sure that our CHWs are having the same education information, making sure that they are in the know of what's upcoming, what's in the trend, because the CHWs are boots on the ground. So they are the first ones to encounter, some of these questions from the community members with that. And so do really appreciate Dr. Solis and her team.
That's great. So I was struck by one of the last points that Dr. Solis brought up regarding the lack of a consortium in Central California for mobile health, which seems surprising given some of the needs that you guys are facing. And, arguably this is one of the most important areas where we want to develop mobile health programs. So I think it's wonderful that you guys are pushing towards establishing that work. One of the related questions to that I had was, as you're having these conversations with policy makers and other key stakeholders, what have you found are some of the most important kind of driving points in getting them to think about the need for sustaining this work, and how do you approach those discussions?
Yeah, that's a great question. And so for me, what I'm finding is that likely it will have to be like some sort of braided funding. So usually when I talk with different partners, whether it's a health plans or philanthropy or other types of funders, it's usually like, okay, maybe I can fund X percent if it's matched by the department or so forth. So they do want like some sort of commitment, but I think that's the key that I'm seeing, is that it likely will have to be some sort of braided funding, but people are open and they're seeing the value in like mobile health now, because again, it's not just Fresno County, but other health departments are starting to do this. So I do think like that's one key thing about having the braided funding. And a lot of meetings that I've had, people are asking for data. So they want to know if they're going to invest in this. Is it proving to be successful? Is it showing like improved emergency or less emergency room use, as like that was one of our goals. So that's why I think for us, we do work closely with our epidemiology team, and we capture not only services rendered, but even, for example, when talking with health plans, there's certain measures that they look for called HEDIS measures, and one of them is like routine vaccines. So that's why for us, it's like, okay, well, we're doing that. Another one is like blood pressure management. Like the doctors do offer like a 1-month prescription, as I mentioned, just in case. So because a lot of times people go to the emergency room for med refills. We see that often because they can't get in to see their primary care doctor. So what I'm seeing is also the importance of data, and there's just a lot of movement in the state about like data exchange. There's a lot of meetings, at least from the health officer side, about working with hospitals and sharing data. And so I feel like that's a big direction the state's moving in. But at least for sustainability, I think with any program, just showing the impact and how do you do that, like with data. So I think it's great that our medical residents, some of them are trying to do the IRB, but that's, I feel like, more for academic versus for sustainability. It's more showing the impact, like how many of these routine vaccines did you do? And not only that, like I was in a separate meeting, and a lot of kids miss school because they don't have those required K-12 vaccines in the fall. And so we do have an immunization clinic at the health department, but sometimes we just can't accommodate. It's just a long wait list of people trying to get in last minute. And so now we're really trying to get the word out with rural mobile health. Like, hey, this is another area. You don't have to drive an hour to downtown. We'll meet you over there. But I think, yeah, that's a great question. So those are some areas that I've identified for some of the key players, and addressing policy. Like another thing is about Medi-Cal reimbursement. So that's why we're asking our providers, like, hey, look into that. That's another sustainability piece. And even with our local hospital that unfortunately closed in Madera, that was a big issue with like Medi-Cal, where a big proportion of their patients had Medi-Cal, and so had lower reimbursement than other hospitals who have a different payer mix. So that is something, again, not really related to mobile health, but overall in policy, because it is affecting access to healthcare in rural areas. And it's not just that hospital. The state does have a list of other hospitals that they're concerned about that may close soon. And that is a policy point that often comes up about payer mix and reimbursement. But I think for us, sustainability, that is something that we're looking into as another revenue stream.
And I think I saw that Muriel from Brown Miller Communications might be on the call as well. So I don't want to miss the opportunity to say that it sounds like a part of the data argument is the storytelling piece too. And I think that was captured so well in that short video that you guys made, that there's something to be said that's really important about sharing how this has personally impacted the lives of the residents in Fresno County, and being able to express that. So it sounds like you guys have been able to find ways to incorporate that into really sharing the importance of this work and the benefits and outcomes that you're seeing. So I think that's really, really wonderful.
Thanks.
And as we are starting to get towards wrapping up, maybe for the last question, if there are no others, I'm wondering if you can sort of maybe reflect a little bit on your experience in this career and on this career path. And I know you shared a bit about your personal journey before, but thinking about how you sustain yourself in this work, and any advice that you might have to fellows that are starting to kind of get involved with their public health departments, if you could reflect back to, way at those times where you remember people doing that in fellowship, and what you might suggest they take advantage of in terms of like the Champion Provider Fellowship opportunity, and any sort of any other tidbits that you'd want to share.
Yeah, no, that's a great question. So I think for me, as I mentioned, when I was living in Los Angeles, I was 100% clinical. And I felt that I wanted to do some more public health work. So that transition, I think for me, I felt it was pretty big, because I went from 100% clinical to now really it's much less, but I'm still involved, as I mentioned. Like, I help out with our clinics as needed here at the health department. But I think for me, what you said, like what fulfills me, is that I see the impact of the programs we do, not only by like every once in a while going out to the events and seeing what's happening, but like seeing like the data, all the services that we're rendering. I think for me, it's like, if we weren't there, this wouldn't have happened. And really, I feel like it was like right place, right time, where with ARPA funding, this rarely happens, where the federal government gives all the counties this much money, and it's like not as many strings attached, because usually with federal grants, there's all these reporting things and everything you have to do, so it's really sometimes strict. But I felt with ARPA it was very flexible, and I think that allowed us to be more creative. And I think looking back, I do feel like sometimes with this funding, though, it'd be easier to implement if it was like longer periods, in terms of like, sometimes with grants it's like 2 years. So I've seen, since I started here, sometimes some grants are like, okay, 2 years, and then it's over. And it's sometimes hard to accomplish or make a lot of progress in such a short time frame, because I've learned that it takes time to build a program up. But so at least personally, I feel like that's what sustains me, like following my passion. Like, again, I love seeing patients and family medicine in the clinic, but I felt a lot of times frustrated that a lot of the root issues was like related to social determinants of health, and and so I feel like now I'm able to get more at the root of those causes. But what I would share with the fellows is that there's a lot of opportunities to get involved with your health department. I think this fellowship is like a great way. Like, already you have that connection with a local health representative. And you can share with your because I mean, there's a lot of different projects you can get involved with Champion Provider, but I think for me, like, even like the media aspect of it, like in my job, I do help out a lot with our media team and interviews, and I am bilingual, I do English and Spanish. But I think even sharing that with your local health department, if you are interested in that, like, hey, any requests that come up regarding if you're passionate about like obesity, or like any other, like, or diabetes, if you're like me, like family med doctor or a dentist, like a lot of the health departments have an oral health program, and sometimes we do get requests from like either media or like print about certain topics. So I feel like even sharing that with your local health representative, if you're a current Champion Provider Fellow, that can they'll keep you in mind, because sometimes that does come up, and especially for the smaller counties, like there's a bigger need for that. But yeah, I think make the most out of the fellowship. Like, for me, I was already working here like part-time, but I really got to know I don't know if she's on the call, but Rosemary was like the liaison for the health department, and I really got to know her. But I feel like like just really developing that relationship with your local health representative can be very impactful.
Yeah, that's really wonderful. I think really helpful point to share, and helpful advice about making sure that you make yourself known as an available resource to the health department, and take advantage of the opportunity in that sense. So I really like the idea of having those concrete things that you can kind of go to them with, and that's helpful for our fellows to think about as they're in the course of their training. So just want to thank you again for the presentation. This is really wonderful. And thank you to everyone who's able to join us today. I'd also like to remind everyone that we have recorded the presentation, and the recording will be available as well as the slides, so that you can access them online at our website. And we'll send out a link to the recording as well when it's available within a week. So sometime next week, look out for that. And yeah, and please reach out if there are any questions that you did not get a chance to ask, and we will work on getting some answers for you. Thank you so much. Thanks, everyone. Have a great rest of the afternoon.